Good evening, everyone. Am I audible? Can you hear me? Dear friends, we were discussing 11.20. Only 1 minute. In the TCM, there is a one condition that is called liver chi stagnation. I think you are aware. What is liver chi stagnation? So before understanding the concept of liver chi stagnation, first we should know what is the liver chi. If we talk about the liver chi, liver chi always want to move around. This is the nature of liver chi. Like we are having multiple organs in the human body. We have liver, we have spleen, lung, kidney. If we talk about the spleen is having nature to lift the chi, to lift the energy up. So if we want to hold anything, we will take the help of spleen. Spleen is sending everything in the upward direction. This is the normal direction of spleen. Sometimes spleen is ill and not able to send the things upward, then person is suffering with the disease like the diarrhea, like the wrinkles, like the prolapse. Now we talk about the lungs. Lung is sending the chi in the downward direction. Lung send the chi downward. So this is called normal direction of lung. Then person is having wonderful health of the lung, good breathing pattern. But suppose there is a problem with the lungs, maybe infection in the lung, and lung is not able to send the chi downward. Then the person is suffering with the shortness of breath or disharmony of the lung. In the same way, each and every organ having a special direction. Whether you talk about the small intestine, large intestine, kidney, each and every organ having a special direction. If we talk about the liver is sending the chi in multiple directions. Liver is having multiple directions. It is sending the chi to the head, to the eyes, and to each and every part. This is called normal direction of liver. Sometimes liver chi is very, very high. Then it's sending too much energy to the head, then person is getting migraine headache. It is sending too much energy to the eyes, person is getting red eyes. Even it is sending too much energy to the stomach, spleen, large intestine, and they are suffering. So what I want to tell you, my concern here is liver is the place of anger. Okay, liver is also having connection with the anger. Liver is the great general. Liver is the great fighter, and liver want to send the energy all around. This is the normal nature of the liver. But sometimes there is a emotional suppression. Suppose someone is suppressing any type of emotion, maybe it's anger, maybe it's crying, maybe it's sadness, any types of the emotional suppression. What is emotional suppression? The emotional suppression, how can be defined with the TCM? Emotion are energy. Emotion are energy. Like joy means more energy. Sadness means low energy. Anger means more energy. The fear means very, very poor energy. So all the emotions are nothing but energies. Now, emotional suppression means you are suppressing the energy. So when the person is doing any types of emotional suppression, then it creates liver chi stagnation. Liver chi is not able to flow all around. It maybe it's flowing in this direction. Maybe it's flowing in this direction, but at somewhere it is blocked. So any types of the emotional suppression will create liver chi stagnation. Then this energy want to move from here but not able to move. Then energy will be bubbling up here and energy become excessive here. Then the liver chi become excessive and liver chi is very, very high. Liver chi is very, very high. Why? Reason is emotional suppression. Now this patient, this male and female, is having too many problems. As per the master tung 11.17 is the wonderful point. It is called Bud anger point. Or we also tell it Bud point. This is the great point who is releasing liver chi stagnation. Let's see the location of this point. So if you look at the location of this point, you can see here. This point located in the index finger. So we can see this is the location of this point. I will tell you how to locate it. We can see in this image on the border of bone on the palmar side, this point is located toward the middle finger. This is called 11.17 or Wood anger point. I inserted this point to one female patient, and after 10 minutes she start crying. tears were flowing down. She told me, the doctor, there is no reason. I don't know why I'm crying, why the tears are coming, but I'm feeling very, very light. So she was having no any sadness at that moment. She was not thinking something, some movement who bring cryness, but she was just crying after putting the 2 points, 11.17. Why? Because 11.17 points releasing the liver chi stagnation. So look at the index finger. In the index finger, we have to go to D line, D, A, B, center is the C, then D line on the border of bone. And if you go on the side, there is the E, then the F, then the G, then the H, but we have to move on the D line. Let's palpate the border of the bone and insert 2 needles here at the equal distance. And we are using this point in the left hand because we want to treat liver. So 1 point here and one another point here. You can see these are the 2 points unit on the border of bone. This is called 11.17. Excellent point. So when you are putting any needle in the index finger, remember, index finger is the finger of large intestine. And if you put any needle in the index finger, it will be working on the large intestine or the liver. So question comes, okay, it's okay. Large intestine is okay. We know that because large intestine meridian passing from here, why the liver? But as per the master too, index finger point are very good for large intestine and liver. Then we can see the concept of master tune, why liver. Then master tune is explaining in that way. In the acupuncture, there are total 6 families. Number 1, Tai Yang. Number 2, Tai Yin. Okay. Next, Sao Yang. Another is Sao Yin. And number 3, Yang Ming and Zuin. These are the 6 families: 1, 2, 3, 4, 5, 6. Okay. So the meaning of Tai Yang means small intestine and urinary bladder. This is the name of family. We just have to memorize it. The meaning of Tai Yang means lungs and spleen. So Tai Yang and Tai Yin are they are connected with each other. We can see the name Tai Yang and Tai Yin. Both are Tai and Tai. So they are connected with each other. So Tai Yang will affect the Tai Yin and Tai Yin will affect the Tai Yang. SI and UV will affect the lungs and spleen. Right? In the same way, Shao Yang is affecting the Shao Yin. Shao Yang. Shao Yang means triple wormer and gallbladder. They will be affecting the Shao Yin means heart and kidney. You want to treat the heart, put the point on gallbladder. Right? Or you want to treat the gallbladder pain in the gallbladder meridian, you can treat the kidney or heart. Right? So Shaoyang and Shaoyin are affecting each other. Dr. Tan has discussed this thing in the very, very detail. Dr. Tan. That is called the balance method of Dr. Tan. And even the global balance of Dr. Tan. They have discussed this relationship in the very detail. The remaining last one is Yang Ming and Zuin, they are affecting each other. They are influencing each other. They are balancing each other. So this is called balance method. Tai Yang is balancing the Tai Yin. This is the balancing. Shaoyang is balancing the Shaoyin. This is also the balancing. And Yangming is in balancing the Zuin. This is also the balancing. Yangming means Li and St, and Zuin means pericardium and liver, right? So they are balancing each other. Let's see the inner circuit. Inner circuit means Yang Ming and Zuin. Yang Ming means Li and St, large intestine and stomach, and Zuin means pericardium and liver. They balance each other, or we can make the circuit in that way. Li will balance the liver, pericardium will balance the stomach, because Li is the meridian of upper part, liver is the meridian of the lower part. So upper part will balance by the lower part. So that's why when you are putting the any point in the index finger is the finger of large intestine, but whenever you are putting any needle in the index finger, this needle is working on the large intestine as well as the liver, right? Liver. Index finger is the finger of liver as well. So when you are putting the point 11.17, 11.17 is the point. 2 points here, 11.17. These points are very good for large intestine as well as the liver. And just we talked about the liver because these points working on the liver chi stagnation. Someone has suppressed the anger. And suppressing the anger will create many problems. So let's come back here. In this way, if the person is suffering with the dry eyes, dryness of the eyes, right? Dry eye is the very challenging problem. And yesterday I discussed with you, if the person is having dry eyes, we can use upper three yellows, means 88.12, 13, and 14. And gallbladder 37 and the kidney 7, 7, 7. This I discussed yesterday. Because 88.12, 13, and 14, this was the discussion of yesterday, that these 3 points unit. 88.12 in the center of thigh, 13 upper point, 14 this lower point, 88.12, 88.13, 88.14 or upper three yellows are very good point for eyes. But if they are combining with the 11.17, it becomes a wonderful protocol, because liver chi stagnation or liver involvement is also responsible for the dry eyes. As per the TCM, what is the dry eyes? As per the TCM, we know there is a theory of yin and yang. As per the TCM, the meaning of dry eyes is liver fluid deficiency or liver yin deficiency. 11.17 is the one of the great point for liver yin deficiency. So here, when you want to work on the dry eyes, take the gallbladder 37 point. Gallbladder 37 is the Leo point of gallbladder, and this is the special point of eyes. Okay, yesterday I discussed this location, even needling. Then kidney 7 also I discussed with you. Kidney 7 is two tune up from the malleolus. Kidney 7 is also the very good point for the eyes. Now today I'm telling you, if you combine 11.17 with the 88.2, 12, 13, 14 and gallbladder 34 and the kidney 7, this become an excellent protocol for the dry eye, right? So here I would like to bring you focus. 11.17, this point is very good for liver yin deficiency. So it's also treating the night sweating, right? So when the person is telling you, doctor, I'm having sweating, I get lots of sweating. So we are asking, okay, you are having lots of sweating. So we are asking, okay, you are having sweating throughout the day or in the night, or you are having sweating just while eating the food, just while eating the food. Because if the person is having sweating just while eating the food, many person when they eat the food, they sweat a lot, even the sweat on the nose and over the whole face region, lots of sweat just while eating. So this is the sign of stomach heat. Okay, stomach heat. One day, one of I went to one place and many persons were eating, and one of my relative was eating the food. I've seen it was full AC, air conditioned hall. Even we were feeling shivering, but while eating the food, he was having lots of sweat over the nose. Even the air condition is on, very cool weather, but the person is having stomach heat, will be sweating while eating the food, right? And this sweat will be on the face or on the nose. Then treat the stomach heat. Now, the second thing, if the person is telling you, I'm having sweating only in the night when I sleep. Nowadays, it becomes very difficult to find out because many persons are sleeping in the air conditioned room. So sometimes it becomes difficult because of air condition, they are not getting sweat. But the person is getting night sweat, there's a sign of yin deficiency. Not only night sweat, any problem in the night, like thirst in the night is the yin deficiency. Sweating in the night is yin deficiency. You're not feeling sleepy in the night, it might be yin deficiency, right? So yin deficiency. So if the person is having dry eyes means, suppose if the water is not there, then land will be dry. In the same way, if liver fluid is not enough, eye will be dry. That is called liver yin deficiency. So I was telling you 11.17 is a very good point for liver yin deficiency. Many person nowadays, if you are using your mobile all the time, especially if you use mobile in the dark room, guaranteed you will suffer with the liver yin deficiency. So you are closing the light and in the night you are using the mobile, right? One day my daughter, I told, okay, no more mobile. So she took one blanket inside the mobile and she was using. Then suddenly voice came, do. Oh, then I saw she's not sleeping, she's using mobile inside the blanket. It's a very dangerous sign. Okay, please don't do this. If you want to use the mobile, switch on the light, or when you are going for sleep, at least keep away from the mobile at least for 1 hour and splash the water over your eyes, then go for sleep. Otherwise, you are going to suffer with the liver yin deficiency. Through the eyes, you are getting many problems. In the female, liver yin never should be deficient, because if for the female, liver is very important part. It's the control of uterine blood. So if the person is having sweating in the night, this is the sign of yin deficiency. Now, sweating in the night, it is the sign of yin deficiency. Now, it might be kidney yin deficiency, stomach yin deficiency, liver yin deficiency, heart yin deficiency. Then we have to find out. Okay, the person is telling, can you treat my eyes? And I also have sweat in the night. It means liver yin deficiency. But the person is having sweating throughout the day. Throughout the day. The meaning of this, why the person is having sweat throughout the day? Because see, sweat means our sweat is coming from the pores, right? If the person is having too much sweat, it means your energy is very poor and you are not able to hold the liquid of the body. In the TCM language, it has been told we are having many defense layer And when your defense system become weaker, then body is not able to hold the liquid, so more sweating. So more sweating is the sign of deficiency, right? Nowadays it's very common with the young child, teenagers, they are getting palm sweating. You know, palm sweating. Many teenagers are in the anxiety, and as they are in the anxiety, they are getting sweating in the palm. Have you seen someone like this? So that is also yin deficiency, right? So if you want to treat the sweating from the palm, use 11.17, but I will recommend some more point here. So look at here. Sweating from the palm. It's a sign of, definitely it's a sign of yin deficiency. So we can use 11.17. 11.17 is a very good point for palm. Whether the palm are sweating or the palm are dry and scaly. Okay. In both condition, we can bring a very good energy to the palm by 11.17. Liver is the organ who control all four extremities. Extremities means both arm and both leg. So the chi in the both extremities are supplied by the liver energy. 11.17 are very good point. We can add two more points as per the TCM concept, kidney 7 and the heart 6. Kidney 7 is the controller of water metabolism, and heart 6 is also the very good point for yin. So with the help of these 3 points, we can work very nicely if the person is having palm sweating and even the night sweating. With the same points, we can work for night sweating, right? 11.17. So here I told you, if the person is having more lacrimation, sometimes what's happening, we are going in the wind, we are going in the air, and air are touching with the eyes, and suddenly we start getting tearing. So this is called the attack of wind. So we are getting tearing. You might have seen many times what's happening uh, in the cold season, when we are coming in the contact of cold air, sudden we are start getting tearing and also sometimes running nose. So whether water is coming from the eyes or water is coming from the nose, in both condition 11.17 is a very good point. So 11.17 is a very good point for common cold as well as the lacrimation or runny eyes. So either the tear are more or no tear, in both condition we can use it. 11.17. So suppose we are going in the air and suddenly because of the attack of air, suddenly there is tearing happened. Tearing is happening. Then what to do? So what we are doing in that condition? Definitely the 11.17 is a very good point, but we will be using two more points as per the TCM. Gallbladder 20, that is called pool of wind, and the governing vessel 16, that is called mention of wind. We can use these 2 points, right? And it's a very easy to locate both the points. So how to locate the points? 2 points. In the posterior hairline, we know on the back hairline, we can see the depression in the center, that is called mention of wind or the governing vessel 16. And if we go on the side, we can see 2 depression on the sides, that is called gallbladder 20 or the pool of the wind. Even I have seen, if we do the acupressure on the back hairline, posterior hairline, we can reduce the wind. It's a very good area. If just you take some few drops of oil and massage the only hairline, and it will release the wind out. If you are having good time, even you can massage the anterior hairline. So anterior hairline and the posterior hairline is a very good, they will release the wind out. They will expel the wind out. Because if the wind is more, then there might be a lacrimation. And you know, when we are suffering with a common cold, runny nose, flu, as per the TCM, as per the acupuncture, the wind attack. Wind means virus, wind means pathogen, wind means cold air, wind means air. These things are attacking in the human body. We can expel the wind by 11.17 and 2 points, which I told you, right? So 11.17 is play very important. And even I will tell you, just you apply 11.17, forget all other point. They are going to work for common cold. For the common cold, it is a very good point. So look at here now. Very wonderful 2-point combination here. Many person are having dry skin. We can see here, dry skin. If the person is suffering with a dry skin, then we know the index finger is the finger of large intestine. Large intestine means skin. Large intestine means metal. Large intestine means skin. So we are going to use 11.17. And if you remember, on the day 1 or day 2 class, I have discussed with you 11.07 3-point unit. These 3-point unit called finger rapid horses. Good for skin diseases, right? So now what I will do, just by 2-point, I can bring the beauty in the palm. If the palm are dry and scaly, just I have to add 11.17 and 11.07 3-point unit. One on the middle phalanges on the border of bone, 1 to 3. Did you remember I discussed 11.07 earlier? Anyone remember? Even I demonstrated how to needle this. Yes. 11.07 is a very good point for skin. And that day I told it's a very good point for the female if they are developing the black spots on the face because of the emotions, because of the hormone imbalance. So 11.07 is a very good point for cosmetic acupuncture also. Cosmetic. It brings beauty, right? Okay, so let me put, I also want to become beautiful like you. So 11.07, 1 point, 11.07. 1 point, then the second point, then the third point. Okay, I will tell the line. So these 3-point unit are in the F line, F, right? F line. Because we know A, B, C, D, E, and F line, 11.07. Now with it, if I using these 2-point unit, 11.17, it's a very, very wonderful combination for dry and scaly skin. And even it's a very good point for facial skin. It's bringing facial beauty. So we are using it for cosmetic purpose, right? 11 point. I'm talking about the 11.07, right? Which I already discussed earlier. 11.17 in the D line. And this is in the F line, right? So we have to see the previous video very properly so that we can remember everything very properly. Okay. Look at in this image. Here we can see 11.07, these are 3-point unit on the dorsal side of the palm. This is on the F line. And if we talk about the palmar side, so we can put 2 point here, that is 11.17. Very good point for rough and hard skin of the palm. Now, if the person is having common cold or the excessive nasal discharge, whether the thin discharge or the thick discharge from the nose, whether the white discharge or the yellow discharge from the nose, in all conditions we can use 11.17. Sometimes what is happening, there is an attack of wind and skin itching started. I will tell you, this is a very common condition. Many patients have reported me in this condition when they are going in the air, or when they are going in the rainy water, or sometimes when they are swimming in the swimming pool having chlorine. Maybe so immediately they start getting itching. So this is called itching, or we can tell allergic itching. Allergic itching, right? Allergic itching. Or we can tell itching because of wind attack. So we can treat it with the 11.17, because 11.17 is a very good point for liver chi stagnation as well as for the wind attack. Especially this point is very good for skin itching and urticaria. Sometimes we are getting too much urticaria, red eruptions, red spots around the body. Just by the single point, we can treat the condition, right? That is 11.17. So we can see there are multiple benefits. Now I would like to move ahead and I will discuss one more point here. So now I would like to discuss you three gates, right? Three gates means intestine gate, which is the very good point for the intestine. Like we can treat the diarrhea, we can treat the constipation, we can treat multiple problems. Multiple problems having connection with the intestine. The second point, liver gate, which is a very good point for the liver. And the third point, that is the heart gate. Right now, out of three gate, I will discuss two gate. Third gate I will discuss in the next class, in the upcoming classes. So let's talk here. If you see here, this is the small finger, and this is the small finger. From the small finger side, if I go Trichun, then again Trichun. Then if I go Trichun, I will meet with the intestine gate. If I go again Trichun, I will meet with the liver gate. These 2 points are one of the great points for intestine and liver. Okay, so look at here. Look at my palm. Look at my hand. We can see here, this is the depression toward the small finger side. This is the Karate side, right? Now from here, from the wrist, if I go Trichun, so I can keep my forefinger and I will reach on this point. This is called intestine gate. It's a very good point for constipation and diarrhea. If the person is suffering with the constipation, we can put this point with a triple warmer 6 and will achieve wonderful result, right? For the constipation, because it's a very good point for intestine and it's called intestine gate. And there are many other problems like Crohn's disease, irritable bowel syndrome, or enteritis. Any problem which is connected to the colon or the large intestine, we can always use this point for all the intestinal disorder. So this is called intestine gate 33.10. One of the great points as per the master team. So we can palpate the sites here, like, and we can feel the border of bone and we can insert the needle here. See, look at here. Suppose we don't want to put the needle, no problem. You can do the wonderful acupressure. Take the 2 to 3 drops of oil or the powder, just massage this point and it will be healing your intestine. Now suppose I am using triple warmer 6 also 3 chun from the dorsal wrist crease here. So this point near about at the same level. So with the help of these 2-point unit, we can treat the constipation, right? Constipation. Now someone is having diarrhea. Then the same point, same intestine gate we can use, and we can take the stomach 43. Stomach 43 is the very good point for diarrhea. Now suppose you are thinking how to decide whether we'll take triple warmer 6 or the stomach 43. I will tell you, even using the single point is wonderful. But if you want to treat the diarrhea, and if you take the stomach 43, it is a very good point. Stomach 43 is given by Master Tung. I will discuss that point when I will be discussing feet. Right now, I'm just giving you a clue. My focus is right now that this is the intestine gate. Now, if I go more 3 chun, then I am reaching to the another point, that is the liver gate. I can do the massage, I can do the acupressure, an excellent point for treating all the liver disorders, hepatitis, and all the acute condition of the liver. So I can feel border of bone and I can insert the needle here. Look at here. This is the liver gate, right? So 3 chun intestine gate, 3 chun liver gate. Many times when I want to treat the liver condition, I use both the points, intestine gate as well as the liver gate. In the acute hepatitis condition, we can use both the points, right? So remember this point. So right now, please remember this point. Second point, if from the wrist crease I am coming 6 chun proximal, I am reaching on the liver gate. Now I will discuss a little more about this. So now you can see in this image, from the wrist, I am reaching 3 chun. Then there is the first point that is called intestine gate. Then again, I am going 3 chun. The second point that is called liver gate. Okay, so 2 points. Now, if you want to work on the diarrhea, I told you use stomach 43. This is 66.05 means stomach 43. But if you want to work on the constipation, use it with the triple warmer 6, just I told you. This PDF will be attached with the course, so you can see there. Now, look at once again. From the wrist crease, I am coming 3 chun, that is intestine gate. Again, 3 chun, that is liver gate. The heart gate will be discussed later on. This is the heart gate. It is a wonderful point for heart. Even a single point, angina pain will go away, chest pain will go away with a single point, even no any other point required. We will be discussing this point later on. But right now, my focus is intestine gate and the liver gate. Okay. So look at here now. So now I will bring your focus on one more point that is called yellow eyes point. So look at in this image, yellow eye point. Yellow eye point is the point is very good for hepatitis. Look at in this image. In the small finger, this is a small finger, look at in my hand. Just a single point here in the small finger, just a center of middle phalanges. This is called yellow eye point. Why the yellow eye point? Because it's very good for the jaundice. Just a center point of the middle phalanges. Very simple point, yellow eye point. You might be thinking too many points, but done, over. Just you have to remember this much. What we have discussed? Yesterday we have discussed 11.20. Today we have discussed 11.17. And 3 point in the thigh and 1 point here. That's it. Enough. Done. Over. With the help of only these points, you can treat entire liver, all the condition of the liver, right? Okay. So if you talk about this, this is in the C line, in the small finger, just in the center, in the C line, just in the center, That is the point called yellow eye point. The reaction area is gallbladder. Gallbladder. So if there is any disharmony in the gallbladder, we are using this point. I will discuss here. Yeah. So now the main thing is coming. Now we'll see here. Look at here. So if the person is suffering with any types of the, like the hepatitis or the yellow eyes, so we are, look at the small finger. This is the point in the center of C line, right? Yellow eye point. Now, sometimes person is suffering with the acute jaundice, but sometimes person is suffering with the chronic jaundice. Now, remember, whether the person is having acute jaundice having connection with the liver and gallbladder, we are going to use 11.23. Or the person is having chronic jaundice, we are going to use 11.23. But if the person is having acute jaundice, we are going to use liver point. Just we have discussed liver gate, right? Liver gate. But the person is having chronic jaundice, we are going to use liver point in the thigh. Now I will do the clarification. Look at me. One question might be coming in your eyes, in your mind. Okay, liver point is here. Even the liver point in the thigh. So how to decide whether to use this point or that point? This question is coming in mind or not? Tell me. How to decide? If the patient is sitting in front of you, how to decide whether I should use this point, liver gate, or the point in the thigh? So answer is this. Upper points are very good for acute problem. Lower points are very good for chronic problem, right? If you are using liver gate, it will work on the acute jaundice. And if you are using the point over the thigh, 88.12, 13, 14, they will be working on the chronic jaundice. And 11.23, always there for the jaundice. 11.23, one of the great point. It should look like very simple, but I will tell you 11.123 is one of the great point who is expelling unwanted humidity and the heat from the gallbladder, who is clearing unwanted turbidity, dirtiness from the gallbladder, unwanted infection from the gallbladder. That's why it's called yellow eyes. So person is having hepatitis and yellow eye, we can use this point. It will do the cleansing of the gallbladder. Now 11.23 and liver gate for acute jaundice. Acute means sudden. And 11.23 and the points over the thigh for the chronic and old jaundice. In the master tongue, we are not doing tonification or sedation. We just treat the point. We never, master tongue never mentioned tonification, sedation. Not required. Even the needling is enough. And the most important thing is this: your patient will get improvement within 3 to 5 sittings if you use these points. 11.23 liver gate or 11.23 plus upper 3 yellows. Got it? Clear? Clear. 11.23 is there. But now we have to decide whether to use liver gate or the point over the thigh. Just we have to decide this. So it's depend on the condition whether we want to treat acute condition or the chronic condition. So let's see here once again. So first I told you the 11.23 point is the very good point for hepatitis with the yellow eyes. Then if the acute jaundice, use the 33.11 liver gate point, which is found in the arm. We just have seen in the arm from the wrist. If we are going section, we are reaching on the liver gate, or 33.11, we are going to use this point for acute jaundice. But if we are talking about the chronic jaundice, with the 11.23, we are going to use 88.121314 upper 3 yellowish. Right. So today we have just discussed 11.17 and 11.23, just 2 points. So the purpose to discuss only few points that you should memorize properly. Okay, there are too many points, but until and unless we are aware with the indication, with the what they're doing, how they're doing, will not able to teach it. Now, please never underestimate the power of 11.23. I will repeat again. Suppose one female is having more dampness and the heat in the gallbladder, what will happen? Where is the gallbladder? Can anyone tell? Where we have gallbladder? Where we have gallbladder? We have gallbladder here, gallbladder meridian. Then gallbladder meridian passing from the side of the chest. Then gallbladder meridian passing from the gallbladder. Right? So never just think, oh, hepatitis. If there is a more damp heat in the gallbladder, there will be too much strange behavior many times, too much strange behavior. Okay, because damp heat in the brain, you can consider damp heat in the gallbladder. Gallbladder is the main meridian of the brain. You can see the root of the gallbladder meridian. Have you seen the root of the gallbladder meridian? Gallbladder 1, 2, then 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, till the 20 point just in the head or not? Tell me. 20 point just in the head. If the damp heat in the gallbladder, and because of the damp heat, the eyes are yellow, whether it will affect the brain or not? Definitely, it will affect the brain. Right? So, it will make your brain very strange. I've seen, and you will also able to find out when you will be seeing the damp heat in the I will be discussing more pattern, right? Then you will able to realize. Right now, just I want to tell you, if you want to clear the damp heat from the gallbladder, use this point 11.23, and just do not restrict this point till the jaundice. Okay, it is going to work for jaundice, for the acute jaundice, for the chronic jaundice, but it's an excellent point for more conditions, multiple more conditions. So today we have discussed 2 points. Now remaining now next class will take tomorrow. Now from tomorrow onwards, our class will be only for enrolled participants. So those who are enrolled, I have added them in the group number 130. That is the final group. And also I have given them access to watch the recording. So even they will able to watch entire recordings. If any enrolled participant is not the part of 130 group, please message me. Okay, this recording also I will publish for all. And for tomorrow onwards, our class will be for enrolled participant only. Thank you so much for this 6 days nice journey. We have done very wonderful. Even intermittently, I will keep on publishing few videos if they are very important for all the participants. So let's close the session now. See you tomorrow. Have a nice day. Bye bye.